Okay, welcome everyone. Thank you for joining us for the event that we are calling the Coalition of Common Sense, local medical and education professionals who want to send a message to Governor Ducey ahead of his press conference in just a couple hours about what is important for our Arizona communities, for our schools, for our families and students. So thank you for joining us. My name is Dawn Penich Thacker. I am one of the co-founders of Save Our Schools Arizona, and I'll just be moving us through our amazing speakers today. We also have members of the press, and we'll have an opportunity for Q&A at the end of the prepared statements. One little point that I want to make, we have several participants calling in from Tucson, which is experiencing storms, lucky for them. And so if there are any technical hiccups or difficulties, we will adjust as best we possibly can. So just to put that little caveat out there. And with that, we will begin. We're going to start out by hearing from Dr. Christine Severance.
Hi, I'm going to go ahead and read our press release for today. In response to a recent survey of Arizona physicians who urged implementation of science-based metrics to guide school openings, a core group of doctors and educators have proposed the following evidence-based milestones be met before schools can be opened in a community for in-person learning. Adequate access to testing, viral PCR testing with a statewide positivity rate of less than 5%, and rapid turnaround of results, preferably less than 72 hours. A downward trajectory of cases over a 14-day period. Adequate number of hospital beds, meaning that we are able to treat all patients without crisis care or surge capacity with appropriate staff to patient ratio. Adequate hospital sufficiency, meaning that we have adequate staffing and equipment and supplies, also meaning adequate ventilators and ECMO machines, as well as people to run and monitor them. For each district and school, we want free testing for educators and staff for every suspected exposure, adequate personal protective equipment and cleaning supplies for all educators and staff, widespread detailed contact tracing within each district with ability to reach affected individuals within 1 week of a positive result. Standards of educational and isolation expectations when a student or staff member tests positive or has a known exposure, whether that be in or out of the school. According to the recent survey of Arizona doctors with school-age children, over 80% desire a delay of in-person instruction. Approximately 60% plan to have their children learn online only. 6% opting for a hybrid model with limited in-person instruction, and 6% remain undecided. Clearly, most of the medical community in Arizona does not support reopening school facilities for in-person learning at this time. The decision to reopen schools must be based on achieving these public health metrics, which are based in science and represent our best opportunity to open safely. A premature opening will deepen the public health crisis, resulting in the loss of life and subsequent school closures, and will further damage our economy. There is a growing number of COVID-19 cases in school-age children in Arizona and elsewhere. It is well documented that while some children experience mild disease, others present with inflammatory syndromes that affect many organ systems. Children have died from COVID-19. Also, children are potent vectors of infection to adults. Although someone may survive the illness, many experience long-term neurologic, respiratory, and cardiac and other physical effects that significantly compromise daily functioning and quality of life. Mortality rates alone do not fully reflect the far-reaching dangers of COVID-19. Clearly, based on the fact that Arizona is unable to efficiently test and contact trace, and schools do not have the funding nor the capacity to appropriately mitigate at this time, we cannot in good conscience go against CDC and WHO guidelines and open schools for in-person learning. Our call to action, school boards vote to adopt these metrics as conditions for reopening. City councils, county supervisors vote in support of these metrics as conditions for school opening in their jurisdictions. And PTAs and PTOs vote to endorse these metrics. Thank you.
Thank you, Doctor. We'll now hear a little bit of elaboration of those criteria and recommendations from Dr. Dion Mills.
Good afternoon. My name is Dr. Dion Mills. I'm a board certified OBGYN hospitalist. We are here today speaking about the same things that we've been speaking about for weeks now, asking for the same thing that we've been asking for weeks now. What we want is nothing earth-shattering or groundbreaking. I represent thousands of medical professionals, including doctors, nurses, physician assistants, nurse practitioners, who simply want the management of this pandemic caused by the novel COVID-19 virus to be handled with care, empathy, and guided by science. No one is an expert on COVID-19, but thankfully we have much knowledge from our study of viruses and epidemics that are available to guide us. So far, most of that knowledge has proven true for this virus as well. We know that the spread of airborne pathogens is curtailed by wearing masks, staying physically away from other people, washing our hands often, and avoiding touching our face or sharing utensils, cups, etc. This is also true for COVID-19. We know that avoiding large gatherings, especially in enclosed places, help to curtail the spread of airborne pathogens. This is true for COVID-19 as well. The Centers for Disease Control, World Health Organization, and even the White House COVID resource site has been consistent on criteria that we must meet in order to safely proceed cautiously with business as usual during a pandemic. All that we ask is that the state of Arizona follows those guidelines. Governor Ducey and Dr. Kara Christ are simply committing malpractice when they go against the established and well-proven standard of care for management of this public health crisis, and the effects have been indisputable. Had they made sure to meet the criteria for reopening and followed the gated, phased method of deciding which businesses should open first and which should wait, had they possessed the ethical clarity and mandated statewide mask wearing from the beginning of reopening, we would very likely have been able to meet criteria for reopening our schools on time. We all know that school administrators are being lured away from following the science by the financial restrictions caused by Governor Ducey's refusal to fully fund them. It is blackmail. Even when schools are able to open in person for in-person learning, they need the funding necessary to buy adequate cleaning supplies and adequate personal protective equipment for everyone. We need the governor and Dr. Christ to advocate for and accommodate the flexibility that is needed right now. I represent thousands of medical professionals who know very well that not every parent is able to keep their child home for virtual instruction. We have households without sufficient technology, households with parents who both need to work outside of the home, households where children rely on schools for most of their meals of the day. We have children with special needs who would not do as well without direct interaction with their educators. Fortunately, we can both follow the science, keeping most of the school learning virtually, and accommodate those families as well. If we keep the majority of the students home learning remotely, we can better keep the children and teachers safe who need to be at school. We need the funding to be able to still provide school lunches to kids studying at home. We need to increase our financial support of those in our behavioral health and social services community so that home wellness checks could be performed for children that we already know may not be in a stable home environment. The management of this pandemic is literally an exercise in equity. This is our opportunity to prove that we do care about the health and well-being of all Arizona citizens, not just a select privileged few. Eyes are on you, Governor Ducey. Our group of physicians have collaborated with educators and legislators throughout Arizona and have developed our own school recommendation document to provide guidance to schools once scientific criteria has been met for reopening. As with everything that we have written or stated, these recommendations are also evidence-based. Kicking start dates down the road 2 weeks at a time has set up an environment of chaos and uncertainty for both educators and parents. We cannot predict where our state will be a few weeks from now, but we do have control over that to some extent. We must enforce strict restrictions on types and sizes of gatherings in this state. We must keep restaurants closed for in-person dining and keep gyms closed. We must mandate mask wearing statewide, and we must keep schools closed for in-person instruction to the majority of students until the evidence-based criteria have been met. Thank you.
Thank you, Dr. Mills. We'll now hear from Superintendent Gabriel Trujillo of the Tucson Unified School District.
On behalf of Arizona's second largest district and the largest comprehensive school district in Pima County, behalf of the 45,000 students that call us home, the 8,000 employees and parents that choose to serve our community, I call on Governor Ducey to extend the prohibition on the physical opening of schools. Out of an extreme concern for the safety, health, and well-being of our student body and of our employees, I implore the governor to extend this executive order prohibiting the physical reopening of schools. I encourage the governor's office to make decisions based off of the evidence-based criteria that the previous speakers have referenced, and specifically through the analysis of well-established medical data points around the extent to which COVID-19 is spreading throughout our communities. The decision in the executive order to require a physical learning space effective August 17th leaves our district seriously compromised in three ways. First, our district, like most districts around the state and around the nation, are experiencing serious and concerning challenges with regard to the supply chain in this country, with regard to the receipt of vital resources, materials, and supplies that we need to provide a safe CDC compliant environment for our employees and our students. Struggles to receive Chromebooks, masks, hand sanitizer, disinfectant soap, and cleaning supplies leave me seriously concerned about our state of preparation and our state of readiness to serve our community on August 17th. Serious concerns about an effective and accessible testing infrastructure, not just in Pima County, but around the state, as well as the lack of an effectively communicated, well-structured, and well-coordinated plan for contact tracing in our county have also left our district seriously compromised in our ability to ensure the healthiest and safest work environment and academic environment for our students and our staff. For the Arizona legislature, when you convene again in January, I implore you to make the decisions and tackle the issues that you failed to tackle when you opted to close the session early, even with the issues of the school calendar and the inequities in funding before you, you still chose to adjourn the session. I implore you in January to take on the issue of equity and funding. The current funding structure that sees approximately 5% less funding per student in an online learning environment as compared to students that are physically attending schools leave each and every single district and school financially vulnerable and less off than they were last year by moving their students to an online remote learning environment. Right here in the Tucson Unified School District, if 100% of all of our students study in an online remote environment with this current funding structure that sees us getting 5% less per student, we will take a $215 loss on each one of our 45,000 students. That will equate to $4.9 million less in funding by the time we hit fall break, which is the end of the first quarter. I also implore you, legislature, to take on the 180-day school calendar rule that is still in effect, even in the face of an unprecedented worldwide pandemic that calls for flexibility, the kind of flexibility, time, that would allow us to meet the needs of our employees and our students in this drastically serious situation that requires fluidity, flexibility. Arizona legislature, I also implore you to deal with the question of AZ merit. School districts around the state, administrators around the state, we have drastically altered the learning environment for students. We have drastically altered the expectations for teachers. We have taken away valuable resources and replaced them with COVID-19 precautionary measures in the classroom. Gone are the pedagogical strategies that we know work for kids: project-based learning, working in teams, small groups for reading, guided reading instruction with the teacher and small partners and triads of students. All are gone, replaced with social distancing, masks, restrictive sanitation protocols. But yet AZ merits restrictions and expectations remain the same. Arizona legislature, I implore you to deal with these three issues immediately when you take your seats in January.
Thank you, Dr. Trujillo. Next, we will hear from Crystal Foster. She is the president of the Tucson Unified School District Governing Board.
Thank you. Thank you for having me. I am one of the board members who wrote the letter to Governor Ducey a few weeks ago that over 100 school board members signed on in agreement to. And in that letter, we asked for 8 specific asks that we must have to move our school districts forward. I'll just hit on 4 of those right now today. One of those is full funding for remote learning. We absolutely must have full funding, as Dr. Trujillo just explained, for remote learning. We can't have a financial, we're in handcuffs with this financial decision, having to decide between in our case, a $4 million hit or the lives of our teachers and our students in our community. We also ask for agreed upon metrics, evidence-based metrics that we agree upon, that we will meet those metrics before we return to face-to-face learning in our buildings. And we have to prioritize public health over politics when we are deciding on those metrics. Absolutely, they must be scientifically based, and they must be agreed to by the majority of the medical community. And then we must have safe standards that we agree to of what a safe classroom, what are those standards in that classroom? And then we have to have funding to meet those standards. We heard earlier about every classroom in the United States right now needs those materials. And so we have to, that's a reality of, can we have the materials that we need, the supplies we need to keep the classrooms safe according to the CDC guidelines, and we have to fund that. And the 4th one I'll talk about from our letter that we wrote was to extend the school closure until October 1st or the end of each district's first quarter. And we ask for this for respect for our educators. There's so much anxiety right now amongst our educators. I can't tell you how many teachers are reaching out to me saying, I don't know if I'm going back to teach. I will retire if I can't stay at home and keep my family safe. And that anxiety, because we have our Governor Ducey, you have just kicked this decision down the road every couple of weeks, and now maybe another couple of weeks, rather than respecting the professionals that are educating our students. And they should have had this summer to plan for this remote learning that they were expecting them to do. But instead of having the time this summer to plan, the anxiety that has created, our teachers have been advocating for their lives. They have been advocating for you to, and for leaders across our state to keep everybody safe in our communities. And that anxiety, if we could have the first quarter, knowing that the first quarter of the school year, they will be safe, then I think I know our teachers will be able to plan, and they will be able to rise to the occasion of what is being expected of us right now to educate our students remotely. And then in October, then we look at those metrics. And while our teachers are teaching, then the state leaders, then we'll hash out the politics, unfortunately, the politics around the metrics, right? And we'll have time to hash out those politics and decide on what are these agreed upon metrics for a safe return, what are the agreed upon standards for a safe classroom. And then in October, we'll review those and see if we're ready to go back. And lastly, I heard somebody say it wasn't because we closed the schools that slowed the virus down. It was because we did social distancing. I'm sorry, but closing the schools was the greatest contribution to social distancing across this country. And if we are saying we must continue to socially distance, then we must continue to keep our schools closed and our students and our families and everybody safe. So please, we urge you, we implore you to continue this closure, to keep everybody safe, and full funding for this unprecedented time that we find ourselves in to educate our children. Thank you.
Thank you so much. If you're listening and this is speaking to you, please feel free to be reaching out to the governor. He's got all of these decisions in his hands. Next, we will hear from Michelle Capriotti. She is, among other things, a teacher in the Chandler Unified School District. Michelle.
Yes, so to piggyback on a lot of what our last speaker said, I'm here to share the voice of an educator. I am Michelle Capriotti. I'm a 20-year educator in Chandler Unified School District. And typically this is a time of year where we're filled with excitement. What will I wear to school on the first day? Bags are packed with new notebooks, pencils, and fresh highlighters. On the first day of school, there's both nervousness and excitement. While we know that there are 1.1 million students in Arizona public schools that have these feelings, so do approximately 50,000 teachers in Arizona, along with 50,000 support members and staff. This year, however, things are much different. Excitement has been replaced with fear. And while some have been dismissive of this, it does not change the reality of the situation. The President of the United States said in his press conference this week that things are going to get worse before they get better. What roles do schools play in this grim reality? Will opening schools in person help or hurt those that we hold closest to in our heart, our children? And while I have 4 children of my own, over my 20 years as an educator, I've had 1,000 students in my classroom, probably more. I have taught at the elementary, junior high, and high school level in both general ed and special education classrooms. I'm a proud Arizona educator, and while I could list the accolades and degrees behind my name, this means very little in this conversation, because what I pride myself on is how I treat my students. I treat them as if they were my own children. If I had my students with me today, both those that I taught in 1995 or those that I had this past year, that they would tell you that the thing I value most is relationships. I attend weddings, graduations, and baby showers years after they've left my classroom. Sadly, however, I've also attended funerals. Losing a former student is a pain like no other. This is a fear, a real fear. I do not want to attend another funeral for a student. This past week, I lost a coworker in my district, a beloved coach and teacher of over 20 years. Our community is mourning. Science tells us this will be our reality if we move too quickly. We have one chance to get this right. We have seen in Arizona the impact of advancing without acknowledging science and data. We would not be in this position today had we stayed the course and opened with caution. We ignored the metrics, and that is why we are here today, facing the reality that opening schools at this time is not safe. No teacher dreams of starting school online. Typically, this is the time of year we're putting up a great new bulletin board we found on Pinterest. This year, teachers are writing wills. We are afraid we'll be headed into crowded classrooms for large blocks of times or forced to teach online from a classroom because of a lack of trust. And while many of us told us, if you don't want to teach in the classroom, just quit, that is not the answer. We already have a teaching crisis in Arizona. We have the worst teacher retention rate in the nation, and the way this pandemic has been handled in terms of schools is only making it worse. I personally know 11 coworkers who have or are planning to quit, some because they're being forced into in-person teaching, others because they feel it's being made clear our work and even our lives are not valued. If there was no way to educate but to risk lives and livelihoods, that would be one thing. But we can educate and stay safe simultaneously in the year 2020. Driving out our educators out of the classroom is not the solution. The school day does not end when the bell rings. We send students and teachers back home. This will further impact the community health crisis. As teachers, we want nothing more than to open our classroom doors, but not at the risk of losing a beloved student, family member, coworker, or community member. Science and the health of our children, our educators, and our communities needs to drive this decision. Thank you.
Thank you, Michelle. Next, we'll hear from a parent in the Mesa School District, Amanda Nichols.
Good afternoon. I am a Mesa Public Schools parent, and I currently have 2 elementary and 2 high school students enrolled in the Mesa Public School District. We're fortunate because Mesa Public Schools was able to purchase an online curriculum for our teachers and our students. Many other school districts are still in the process of creating their own online platforms. Online learning platforms should be fully funded programs. They should be able to create an equal opportunity for teaching our Arizona children. Every student and teacher should have access to the technology that they need to make this work. I know in my district, they're doing an as needed. They're handing out computers and laptops to those that need it. They're doing surveys and finding out who needs access to the internet. We do not need this to create a larger learning gap by not supporting our students and our teachers and our parents with the tools that they need to succeed during this global pandemic. Mesa Public Schools, like many other districts, have included a plan for modified or hybrid classes when they determine it's safe to return to campus, like others have discussed. These plans could limit classroom sizes and offer the flexibility to stay online to fit our families' needs, but many school districts like mine have outlined safety precautions like masks and cleaning processes that we've heard throughout this meeting that are going to be difficult to implement when we cannot have the supplies. But they've not elaborated on the parameters that determine a safe return to our schools. They haven't given us clear guidelines to what will happen when outbreaks occur. As of July 14th, when Mesa Public Schools made this announcement, they were still waiting on the health department to get back to them to create those guidelines. And as a parent, I was like, how on earth can we open these schools when we don't even have a plan for our students and educators when they contract COVID-19? I mean, the current plan that I have done some research on is it speaks of percentages of infection rates, percentages of symptoms, percentages of attendance rates of students. But how many of our educators and our children are we going to sacrifice? How many of those people will become a statistic of those that are sick? How many people need to be that percentage to have a shutdown when and if we open too soon? I have friends that are teachers, and like the previous people that have spoken, I mean, they're terrified. They're terrified to go back to work. They're scared to go to school because they are the ones that are going to be putting their lives online as educators. So I would urge Governor Ducey to be cautious. Please follow these science-based evidence and metrics that we have before opening our schools. I would hold Governor Ducey to his promise. He promised us that this would not become a political issue, that this would be a safety issue for our children. So please follow these guidelines that we're discussing. We do not fully understand the long-lasting effects of this virus. We don't understand what it will do to our children. And I would urge caution when reopening our schools. I really want my kids to go back to school. You know, I as much as anyone, but there's just too much of an unknown when it comes to this virus. My oldest son is a senior this year. He's a football player. He wants a football season. You know, I have a dancer who wants to be with her dance team, but it's just not safe. We believe as a family that we need to remain home. And as hard as it is to keep our children isolated, when all we want is like that semblance of normalcy, you know, we as a family believe this is a social and a moral obligation that we must do this safely. We need to continue to provide our medical and our scientific communities with time. They need time to make these discoveries on treatments, on plans. They need time to build up their resources that we need to combat another wave of or surge of this virus. So someone may listen to this or watch this and think my level of concern is way high. I mean, it might be higher than yours, but that's because I have an 11-year-old son who is at higher risk. Due to his immunity issues and his asthma, we don't know when or how he would respond to this virus. So you know, we take this really seriously as a family. The virus has caused disruption in all of our lives, you know, employment, childcare, schools, sports, art programs, mental health. I mean, all of us have had moments where we've missed graduations and milestones. You know, I experienced this personally when we canceled my mother's 70th birthday, and then we canceled my parents' 50th wedding anniversary. But many of us have also made the sacrifice to not even see our parents or our grandparents or those at higher risk in order to keep them safe. To rush into an unsafe environment, to open our schools to our state reopening, it would just make all those sacrifices for naught. It would just, all those sacrifices would be for nothing. There are concerns, and they are very valid, for the gap in our children's education, for the lack of structure, social interaction, those social nets that we've discussed that are there to protect our Arizona children. And the stress that this online environment will put on our state's parents, you know, our guardians, educators, and our students. I know there are no easy solutions when it comes to these difficult problems. You know, I just feel like we all understand the importance of having our kids back in the classroom, but we want to do it safely. So I spoke with a friend yesterday, and she works as a nurse, and she told me that her hospital in Phoenix is at 125% capacity. I mean, 125% capacity. It just seems negligent to reopen our schools when our hospitals are already overwhelmed. As a parent, you know, it's very concerning to me, and I want this to be safe. I want this to be safe for all of our teachers, for those support staff that we talked about, for our nurses at school, for the people that work in the office, for our janitorial staff, for our aides, not just for our teachers, but also for that support staff. They need that. They need that support, and they need to know that they're going to be safe. So as a parent, I beg you, Governor Ducey, I beg you, make educated decisions based on the scientific metrics, based on the data that is going to provide us with a safe opening. Please protect our educators and our students and our families, and protect our state. Thank you.
Thank you so much. And finally, we will hear from a student. Alexis Aguirre is a student, a senior in Tucson. Alexis.
Hi, thank you for having me. I'm Alexis. I'm an incoming senior at Tucson High Magnet School, which is one of the biggest high schools in Tucson, Arizona. As a student, one of my main concerns is the impossibility of social distancing on campus, in hallways, and in classrooms. In my science class, for example, we usually have up to 32 students or more in class. We have 6 tables that fit 4 students each, and we all share the supplies. In order for us to be 6 feet apart, we would have to have no more than 10 students in a class, and even that is too close in several parts of the classroom. It's clear to me that social distancing is impossible in our schools because we simply don't have the space or the funds to follow health guidelines. My other main concern is about students, teachers, and parents dying. My school has 1 counselor for over 3,000 students. We do not have the ability to meet the social and emotional needs for traumatized students if our siblings, teachers, friends, or parents and grandparents start to die because we infected them with our on-campus exposure. Several of my friends are their grandparents' main caretakers because their parents are at work. How can we take care of our grandparents if we are exposed at school? If I found out I had endangered my own tata, I would be devastated. It is not okay to do that to children and teenagers. It is clear to me and to all of my friends that Governor Doug Ducey needs to keep us safe by fully funding distance learning and keeping students at home until the data says it is safe for us to return. If we return and even 1 student dies, that is 1 life too many. Thank you.
Thank you so much, Alexis. Thank you, everybody, for sharing this wisdom and insight, and for imploring our governor to do what is in his hands to do. We have a couple of questions that have come in from reporters, and so I'll ask those, and if there are other questions, please do wave at me or put them in the chat. This first question is for you, Crystal. It is from Griselda Zatino at KTAR, and she is asking, what would your reaction be if the governor doesn't follow this advice and reopens schools for in-person, or uses metrics that are not data and health based, but rather sets another date, possibly as soon as Labor Day?
This is the most important work I've ever done as a board member, and I will keep advocating and organizing with board members across the state, with teachers across the state. I recognize that I'm 1 vote on the board that I serve, and so I don't make those decisions alone for what our school district will do, but what I do with every other part of my being. I mean, I knew I was signing up as a board member to advocate for ethnic studies, advocate for sex ed, and I didn't know I'd be advocating for people's lives. And I mean, will the hashtag be the Ducey deaths? I mean, we have to hold these elected officials accountable for what will happen next in our community, for the rise of the numbers. And we have to tell the stories of the people who who will be affected, who are affected, and the more and more people that will continue to be affected. And so I will not sit down, I will not stop advocating and organizing around the community. And again, I can't speak for what my board will do, what the board of Tucson Unified will do. I can only speak to what I will do, and I will absolutely advocate for scientific based, evidence-based metrics, and make sure that everybody sees the politics that are being played around this issue.
Thank you so much. There's another question also from Griselda Zatino at KTAR for you, Superintendent Trujillo. She asks whether you have concerns about lawsuits based on bringing folks back during COVID-19 liability coverage.
Yes, we received an official document yesterday from the Arizona Risk and Retention Trust, essentially the insurance for school districts in Arizona. They've officially notified us that they are striking what's known as the exotic pathogen clause from their coverage, which means that we are uncovered for any claims that may emerge on our campuses with regard to the lack of our implementation of precautionary measures, potentially leading to infection from COVID-19. So we will be liable according to the information we received yesterday from the trust.
Wow.
And good news for superintendents, that's not just Tucson Unified. So if your district is covered by the Arizona Risk and Retention Trust, which is pretty much all the districts from the schools of the people on this call, all of us will be held liable.
Wow, that is sobering information. If there aren't other questions, then that would wrap up our time today. If you've been listening to this out in Facebook land, hopefully I think the message is clear. We'll be posting the criteria that our physicians referenced at the very beginning of this broadcast. Please reach out. That's what we can do. That's what regular people, students, parents, community members, that's what we can do. We can reach out to Governor Ducey on social media by calling his office, by talking to everyone in our social circles and professional circles about the absolute dire need to keep our families safe, our teachers safe, our children safe, and also to have the funding both now so that online instruction is the best that it can be, as well as for the return to the classroom, which will happen if we can take the steps and take them seriously now with the governor's go ahead. And so he is speaking in just over an hour, we understand. I think that's plenty of time for him to get this message yet again, because none of this information is new. Thank you everyone for joining us, and please go on and advocate for yourselves and for all of us and for our students and our state. Thank you so much. Thank you everyone for joining us on our medical and educational panel.